for all the interventions that will be needed. We're going to continue our theme in terms of healthy aging, in terms of health care, redefining health, with our next speaker, who is an author and a business strategist for a healthier future. And he has a new book on transformation out actually this week. So he's one of the busiest people around. We're absolutely delighted we have him here to join us. So please give a very, very warm welcome for Christophe Jauquet. Christophe, thank you so much. We're really, really looking forward to hearing from you.
Thank you, Anna.
so much.
Thank you, and good afternoon. I'm very excited to be here. Actually, I've been looking forward to this talk since 2.5 years because we talked about me being on stage here about 2.5 years. Today, I want to talk to you about redefining healthcare in the era of self-care. I'll step away a little bit from the science that we just talked about, and I'll focus back again a little bit on the patient, on the humans that we are seeing today. Who am I? I am a professional speaker, and this is not working right now. Could you see if it is? It's number 2. Maybe the number 1 should have been it. Oh, there we have. Let's see if it works. No, it still doesn't work though. But while I wait for the new clicker, there's about 80 slides in 20 minutes. So it will be TED Talk style, a small talk about how the world is changing while I wait for this clicker. So my name is Christophe. Is it there? Okay. Talking about a smooth beginning. Meanwhile, you've been looking at my face also here on the big screen. But I'm a business strategist. I work as a professional keynote speaker. I travel around the world to talk and inspire businesses about how to make a healthier future. And businesses, I mean healthcare institutions, I mean pharmaceutical companies, but I also mean consumer companies. Because more and more what we see is that these businesses also go into that field. I'm the author of 2 books, second book coming out within 2 days. Healthusiasm was the first book, talks about why people are more than ever occupied with their health. And the second book helps companies to actually make an impact on that. But basically, the major insight in both of these books is the same. And that is, I don't use the word healthcare anymore. That's great, right? Going to the Abu Dhabi Global Healthcare Week and not using the word healthcare. I don't like the word healthcare. It's too much of an on and off switch. You're in the system or you're out of the system. But the reality is, and that counts for everyone, is that we all want to be healthy and happy. So why do we need to have that healthcare switch, right? I'll more talk about health enthusiasm. It's the enthusiasm that we all have to be healthy and happy. So maybe next year we should call it the Abu Dhabi Global Health Enthusiasm Week, maybe. Because that is what's about. People are always occupied with their health. And it's always been that way. Even 2,000-3,000 years ago when they were praying or bringing offers to the gods. But it really changed in the Western world with this lady. This is Jane Fonda, and she actually made people move. It was the first time in history that people started to move to become healthier and happier. And she did it with videos, simple videos. It was the first time that people actually consciously wanted to do some exercising to have an impact on their health and happiness. Which was remarkable because we came out at a time where actually cigarettes were sold like this. Where you can go to or be in a hospital and actually buy cigarettes next to the bed. But ever since the 80s, it all went down. People stopped smoking. People changed their behaviors, and that was a radical change indeed. And that was mainly because we saw a peak in a lot of diseases happening. A lot of diseases like cardiovascular diseases, cancer diseases, Alzheimer. We had a health scare with AIDS and HIV in the 80s. And so people were more than ever occupied on their health. And that is where the health enthusiasm started. That is where people actually started making an impact on their own health. This is what they really wanted to achieve. There was the public health initiatives, but it started with simple things like workout videos. But you see, it ramped up really quickly after that to really become this health enthusiasm trend, as I like to call it. And there's 3 main reasons for that. And I'm not going to go into too much of a detail here, but it's about information, it's about social media, and it's about technology. Because people want to have information. They want to have an impact on their own health. 83% of people say they want to be involved in the decisions that are taken about their health. People go online, and if you have a chronic disease, 40% of people on TikTok say that they change their behavior based on what they see from medfluencers. 40% of people. And then, of course, you have all the healthcare apps and the wearables, which is 1 out of 2 people and 1 out of 3 people that are actively involved with it. This is how the health enthusiasm trend came about. This is what health enthusiasm is. Because let me ask you here, I don't see you really well, but who does not want to be healthy and happy? So I don't see any hand, because everybody wants to be healthy and happy, and this is what we see here. This is the health enthusiasm trend. This is the trend that every one of us has, and it has even been, reinforced by COVID. Health enthusiasm. The enthusiasm that we all have to take care of ourselves, to do some self-care. And that changes everything. Because the belief that the physician is at the center of health is actually maybe no longer true. We are living a Copernican health revolution, and it's the patient at the center now. The patient, him or herself, puts herself at the center, and they have a ton of options around them. And all those options are available to them. And yes, the physician is one of them, and yes, maybe all the other ones are less important today, but that will change. The patient is at the center. Which begs the question, every time again, if I present this, which begs the one question. Yeah, but you are talking about consumers, and health is not a consumer business. Patients are not consumers, and consumers are not patients. Well, I beg to differ, because they're exactly the same person. Sometimes you are, as a person, in a situation as a patient, and sometimes you are, as a person, in a situation as a consumer. And so, we're exactly the same person, and that is important to keep in mind. Because indeed, patients might be involved or should be involved in medical decisions, and consumers, they take lifestyle decisions, which is entirely different. But in between those, there's a ton of other decisions that have an impact on our health, like preventative decisions or well-being decisions. And this is where all this health enthusiasm lies. This is where all the, basically 99% of all the decisions that we take in our life has an impact on who we are, how healthy we are, and how happy we are. And this middle part, the self-care part, is gigantic. If you look at the Google search results, you see that self-care has quadrupled between 2007 and 2017. And then to double it again in the next 4 or 5 years. Wunderman Thompson coached it, they said it, they coined it the super self trend. It's one of the biggest trends out there. People want to supercharge their own health. It's actually a 4.7 trillion business, which is 4 times as big as the pharmaceutical industry. That's how big it is. It's no longer just about reactive care, it's about being proactive. And that, 50% of people on a regular basis take proactive decisions that impact their health. This is health enthusiasm. This is what self-care is all about. And it makes sense, because in society, the way that we live it here or anywhere in the Western world, and even more and more in the Eastern world as well, is that our basic and our emotional needs are largely fulfilled. Which means that if you look at the hierarchy of needs made by Maslow, is that more and more people will look for aspirational needs, the self-actualization needs. You see this really well if you look at how people retire. 10, 15 years ago, when people retire, they would say, you know what, I've done my part, it's over. Now I'm going to live for myself, I'm going to do the hobby that I always wanted to do, I'm going to make the travel that I always wanted to make. And they all waited until retirement. Youngsters today, they don't wait. They make from their hobby a job, or they travel for 6 months, 12 months, whatever, because they want to become the best version of themselves. That is really what it is all about. This is the need that people more and more are trying to complete, to fulfill. And in 2015, there was this one company, trendwatching.com, that says, this self-actualization, this desire to become the best version of yourself, this will become the future of consumerism. People will base their buying decisions purely on who they want to become. And indeed, a couple of years later, more and more companies start saying, you know what? I have to say, every business can be a business. Every business should be a health and wellness business. This is what happened. And indeed, 2021, Nielsen said, it's the most important force if you look at consumers. Health and wellness is the most important thing. Ogilvy then looked at any typical industry at what consumers would want from that industry when it comes to health and wellness and what they're actually offering, and there was a huge gap. They called it the health and wellness gap. So more and more companies will move into that sphere of self-care, of health, of wellness. And just a couple of examples. This is Priya, available on the market in Germany and the States. It's a telehealth solution that also dispenses medication. It recognizes your face, knows who you are, and then will dispense that medication. Will tell you if the medication is out and you need to reorder new ones. And it's put on the market by an appliance company called Black & Decker. You have Mercedes-Benz that has a fit and health car, launched in 2017, one of their biggest cars, of course, most expensive one, purely focused on how can you make the driver feel better. If you drive for 3-4 hours and after that 3-4 hours you feel exhausted, well, in this car you feel better, you feel healthier, you feel happy, you simply feel better. This is what Mercedes-Benz is doing, and it's not the only one, because the entire in-vehicle health monitoring will become a $10 billion business by 2030. Every car company is now focusing on health and happiness. And you see it everywhere, in houses, in supermarkets, Disney, any type of company is moving into that self-care business. This is really what Healthhusiasm is about. This is what the driver is of everything that we do for taking care of ourselves. But the consequences are big for healthcare. You need to think about it, because if all these companies move into this health and self-care space, it's not going to be specialty care, not easily, not quickly, let's be honest. But what they'll do is they'll change things. Because they are focused on experience, they are focused on a lot of different things that the healthcare industry today is far less focused on. And so what you see, and I'll give you an example of the banking industry, is that many organizations that today have no affinity in healthcare will move into self-care and will change the expectations of people. Have a look at the Yes Machine. Launched in 1967. It was the first ATM. What it says was, you can withdraw money anytime you want. It always says yes, as long as there's money in the bank. But it was the first time that there was a self-service solution. And from that point on, it really went quickly. You didn't need to go to a bank. You didn't need to wait for the opening hours. You could just collect money whenever you want. Seems logic now, but that wasn't the case 60 years ago. After the self-service experience, you could actually do remote transactions, for example. You could call and ask to change something to withdraw money. No, withdraw money would be difficult, but to transfer money to somebody else via the phone. From 2000 onwards, you can do it online with a little bit more features, which was interesting. It changed the entire experience. Then came the mobile experience, which was local, location-based, which was sometimes based on reviews, which had a lot of more features, which eventually added the wearables, which allowed you to pay with your watch and your ring, what have you all, to now become a very conversational experience. Yesterday I had problems. I was in a restaurant, I couldn't pay. I asked the chatbot, Kate, as you can see there on the screen, listen, I'm in Abu Dhabi, something's wrong, I cannot pay. And within 2 seconds, the problem was solved by having a chat with a chatbot. And this was a generic chatbot, but we will go into a companion experience where I have my personal companion who will always be by my side. Now, why do I show you this? It is because if companies are starting to focus on health, if companies start to focus on self-care, then we will have to think about all of these experiences, because all these other companies that have no affinity with health today or yesterday, they've went through this evolution. They went from self-service to remote, to online, to mobile, to wearables, to companionship very soon. The question is, where are we? What is the healthcare experience? If you look at this, where are we with healthcare? Because the patients will more and more start to ask it. You know, they're only a small part of the day they are a patient, right? They have a ton of experiences throughout that day. And those experiences create expectations. Expectations that they will also carry over in healthcare. Which brings us back to the question, is a patient a consumer a patient? How should we go about it? Well, a patient is not a consumer because they have different needs, but they have the exact same expectations. They have the exact same expectations, which is something in healthcare that we forget. We focus so much on the medical need we try to solve that we forget about the expectations. So if we are to redefine healthcare in a world, in an era that has more than ever focus on self-care, we need to realize that people have healthenthusiasm. They want to be healthy and happy, and they want to have an impact on their own health. This is what we see here. And that middle compartment has about 4.7 trillion business of value, which attracts a lot of companies, which again will create a lot of whole new experiences, or at least people, patients, humans, who will demand the exact same experience from the healthcare industry. And this is one of the most important questions that you should ask yourself. Where are we with our experience? Because the needs may be different between a patient and a consumer, but the expectations are exactly the same. So in a world where we want to redefine healthcare because of the enormous amount of solutions that are focused on self-care and increasingly focused on self-care, we need to think about how can we make sure that we meet the expectations as well. My name is Christophe Choquet. I thank you for your attention, and if any questions, you can mail me or you can hit me up on LinkedIn. Thank you for your attention.
Christophe, thank you so much. Again, healthenthusiasm, indeed. I love that new word, that we don't need to be calling it healthcare, and it is about getting very enthusiastic, and listening to you, we'll definitely all be very enthusiastic about what we do. But you're so right. I do need some help up here with our chairs, please. Can I have our team up here? We are expecting a big panel, and it's a bit lonely up here when I see only 4 seats, and I know we're going to have 6 people on this at the moment. So please, please, right away, come and join me and change a little bit of furniture. We need that done with great precision and great speed. Good man, no problem at all. I can talk while you're busy there. Just get it done. Thank you. But really, it was great to hear Christophe there. I love the way he looks at this, and it's again from a much more holistic point of view, whereby we need individuals involved, and of course every one of us want to be involved. We will be involved. We are being more involved than ever before. Just think about it. And again, it's putting the patient at the very center of what's happening. But I think also getting rid of the concept of a patient. We don't want to be known as patients. We want to be people who are in control, who are hopefully taking more control of our health, and who know more about our own health. And I think that is the one key thing that has happened, the biggest shift that's happened in the last maybe 10 years. So it's very, very exciting to have people like Christophe really examining this, looking at it, putting so much time and effort and energy into it. And again, I really love the ideas he was saying there, that we look at an industry that is now 4 times bigger than the pharmaceutical industry. So the fact that we can take charge, and we are taking charge, and hopefully all of this will lead to longer, happier, more fulfilled lives, and getting corporations involved and getting the investment community involved, looking at this from a holistic level, so, so important. And who would have known? It all started with our friend Jane Fonda, huh? Oh, there we go. Jane has a lot to live up to at this point, but and she's still with us. So she's doing something right.